with accompanying TV and radio spots to be produced in September. Our research shows that this audience consumes messages differently than the broader population. They live online, which is why this year's campaign will build on the success of previous years to reach our audience where they are, watching shows, connecting with friends, reading content, and listening to music. We're using a combination of platforms and tactics to best reach and surround them with our message, which means tools like streaming video commercials, display ads, digital billboards, radio ads, and social advertising on platforms like Instagram, Reddit, and Facebook. They'll all play a pivotal role in our outreach efforts. Our campaign will also reach Spanish-speaking members of our audience in the Commonwealth. Spanish speakers will see What's the Damage Creative on various digital media platforms across the state. Now I want to hand things over to the folks you don't want to see after a night of drinking, law enforcement. Please welcome Virginia State Police Superintendent, Colonel Gary Settle.
Thank you, Kirk, and good afternoon, everyone. Driving sober is one of the most important messages that we stress at the state police. It is crucial with keeping our roads safe, as everyone would probably agree with that. And last year, in 2023, we had 293 people killed in alcohol-related crashes, nearly a third all the traffic fatalities in the Commonwealth. Over 1,100 people were seriously injured. Those numbers are high. I think we all would agree with that, especially when the goal for all of us is zero. But we're making a difference. This is going to be the second time this month that I am able to highlight the Virginia State Police's Drug Recognition Expert Program, DRE, if you will, for short. State Police is charged with coordinating law enforcement's efforts across the Commonwealth to recognize impairment in drivers under the influence of drugs, in addition to alcohol. And as a sign of how serious we take the DRE program, we assigned a first sergeant with the state police whose sole responsibility is to run that program only. Since making changes to the program in 2022, we assigned, according to the Crime Commission, and after the assignment of the first sergeant, we have seen an increase of 300% in DUI enforcement in the Commonwealth. That's huge. Last year, there were over 14,000 DUI convictions. With that in mind, as we head towards the end of summer and Labor Day holiday weekend coming up on us, I want you to know that troopers will be out in full force on our highways. So if you're not driving sober, we will more likely be stopping you. And if not by a state trooper, it will be by another law enforcement officer, many represented behind me, our sister and brother agencies, as there are over 130 agencies that have joined us in the first wave of drive sober or get pulled over. There have been and will continue to be hundreds of saturation patrols and checkpoints around the Commonwealth. And remember, if you are charged for driving while intoxicated or impaired, you will be facing potential jail time and upwards of $10,000 or more in costs for attorneys. The rates, the fees are astronomical. So we ask you, if you've been drinking, don't drive. It's that simple. And not just for Labor Day, but for the rest of the year, as we will also be ramping up enforcements as we approach the October with Halloween coming up on us, Thanksgiving, and New Year. So this will be a continual effort. So I would ask that we make it easier on ourselves, that being the public. Don't drink and don't drive. And thank you for the opportunity to speak. And now it is my honor to introduce our next guest speaker, the Honorable Glenn Youngkin, the 74th Governor of the Commonwealth of Virginia. As Governor, he has had an unwavering commitment to support our men and women in law enforcement. Governor Youngkin understands the efforts necessary to make our roads safer and to get drunk drivers off our roadways. Ladies and gentlemen, the 74th Governor of the Commonwealth of Virginia, the Honorable Glenn Youngkin.
Thank you. So good morning. Colonel, thank you for your comments, and thank you for the very clear acknowledgement that if you don't drive sober, you will get pulled over. The reality is, the rest of that line is you may in fact kill someone or kill yourself. And so make a plan. The data is startling. From the outset of this partnership between state police, the DMV, and the Drive Sober or Get Pulled Over program has been clear that once we tell everyone that there are severe ramifications, not just financial, not just you losing your license theoretically, but also that you may in fact kill someone or take your own life, we have seen a dramatic decrease in circumstances where people are driving intoxicated or impaired. But the reality is this past year was a year where we saw an actual increase in fatalities associated with impaired or intoxicated driving. That means that we've got a lot of work to do because over time we've made substantial progress, but in the last year, we in fact saw DUI fatalities increase by nearly 7%. That means we've got to do better. And most importantly, we have got to make sure that all Virginians understand that if they are not driving sober, they will get pulled over. Long term, the results have been incredibly important. They have been incredibly effective. And we've just heard again from Kurt the great work that RAP does. And Kurt, thank you for your tremendous partnership over many years. I know that Secretary Miller and Secretary Cole are deeply committed to making sure that all Virginians understand that there are no excuses. Make a plan. Understand that the responsibility that comes with drinking is one that does not include driving. It means make a plan. I want to thank the tremendous effort from law enforcement across the Commonwealth of Virginia. You see behind me men and women in uniform, and every day they go to work to make Virginia safer. Every day they step into danger. Every day they leave their families, and their families don't know whether they're going to come back. That is a commitment that not only deserves our respect and not only deserves our deep appreciation, but more importantly, it's to understand why. It's because they care deeply about Virginians. And the false narrative that it's okay to have a few drinks and then get behind the wheel of a car and drive must be dispelled. And that's why this initiative, this communication, this innovation associated with getting messaging to people where they will read it is so important. Because I do not want to stand up here next year and talk about the fact that the program is doing incredibly well over time, but we had another year of increases. I do not want to hear about nearly 300 Virginians that lost their lives because someone made an insanely stupid decision to drink and then climb behind the wheel of an automobile, or to engage in drug use and climb behind the wheel of an automobile. And therefore, we are speaking to those that seem to be most inclined to do so. Men in their 20s and 30s. Doesn't mean they're the only ones. But this group of Virginians, I think, needs to hear the message more and more. And one of the realities is that research shows that this group of men fully understand the ramifications of being impaired or intoxicated and climbing in a car, because they identify it as one of the most serious dangers facing Virginians today. And yet only half of them make a plan to have a designated driver or find an alternative route home. And that's where our collective work must come into the picture. It's time for us again to make it very, very clear that you will drive sober or you will get pulled over. As we head into Labor Day weekend and we look back on what has been a wonderful summer in Virginia, we had record tourism last year. We have a tremendous fall in front of us. I can guarantee we'll have great weather. Come on, that's a joke. But this is a chance for Virginians to be out, and this is a chance for people to appreciate all that Virginia has to offer. But this is also an obligation to be responsible in how we do it. So tell your friends, share videos, and make sure everybody understands that we must plan ahead and never get behind the wheel of an automobile if you have been drinking, if you are impaired, and most importantly, recognize that you must be sober or you will get pulled over. Again, I want to thank these extraordinary heroes behind me and all of those that serve with them, because this is part of their responsibilities, which I know they take so seriously and yet wish that Virginians would make different decisions. And so as they head out this weekend, in order to keep Virginians safe, we again thank you. We support you, and we stand shoulder to shoulder with you in the job that you will do. That if someone has been drinking and they climb behind the wheel of a car, there will be consequences when they are pulled over. May God bless you, and let's have a safe weekend in the Commonwealth of Virginia. Back to you.
And thank you, Governor, and thank you, Colonel Settle, for your commitment to this issue. I'd now like to introduce Gerald Lackey, the Commissioner of Virginia DMV and the Governor's Highway Safety Representative.
Thank you very much, Kurt, for the invitation to again come and address this important topic with you all. And thank you to RAP for putting this together. Drive Sober or Get Pulled Over is one of the most successful alcohol awareness campaigns that we have in the Commonwealth. It's one of the few that we fund to the level that we actually do. It's not me. There you go. Alongside Drive Sober or Get Pulled Over, every year the Department of Highway Safety at the DMV allocates millions of dollars to programs to combat drunk driving. Overtime and enforcement work with law enforcement, specialized training for law enforcement, advertising and public outreach, and our Sober Ride program for people who go out and have a little too much to drink and need to get home. But the Drive Sober or Get Pulled Over campaign is in a class of its own. Every year they contribute significant impact to the Commonwealth by helping young men make different decisions. And the What's the Damage campaign is another example of this. They always center around three core messages. Don't drink and drive. Don't get in a vehicle with somebody who's been drinking. And plan a safe way to get home or identify a designated driver. And as many of those have said up here, I didn't say young men accidentally. This is the target population. Unfortunately, the research shows that overwhelmingly the problem is young male drivers between the ages of 21 and 35. And every year, RAP does surveys and researches with this group to understand exactly why they think and do the things that they do. Here's some interesting statistics. Nearly 2/3, that's 63% of young males between 21 and 35 in Virginia admit to having driven after drinking, admit to getting in a car with someone who's had a few to drink, or doing both. That's an unacceptably high number. And as Governor Youngkin said, the research also shows that despite almost all of them knowing the serious consequences of drinking and driving, less than half, 44% specifically, make a plan to get home safely. We have to change that behavior, and we have to change how they think about that. So, our key partners like Drive Sober and Get Pulled Over are core to helping us do that. Drinking and driving not only endangers the driver, it endangers their passengers, it endangers other drivers on the road, it endangers pedestrians, and let's not forget about each one of those people has a family. One impacted life is dozens of impacted people. The impact of this one bad decision is nothing less than life-altering, and I'm proud to support the Drive Sober or Get Pulled Over campaign. Thank you.
And thank you, Commissioner. Finally today, I'd like to introduce to you today finally today, I'd like to introduce you to Dr. Michael Abutanos, Director of the Trauma Center at VCU Medical Health, who is here to speak on the all too real medical consequences of drinking and driving. Doctor.
Thank you, Kurt, for the kind introduction and for inviting me again to be part of this very important campaign. So I really appreciate the chance to join once again this year to talk about this very important issue that we face daily. So I'm the Chief of Trauma and Acute Care Surgical Services at VCU Level 1 Trauma Center. And as a trauma physician and surgeon here in the Richmond area, I and my trauma center colleagues, ER physicians, nurses, surgeons, intensivists, social workers, pharmacists, injury prevention specialists, etc. We're all here at VCU and throughout the Commonwealth. We all have seen countless lives and families severely impacted by drunk driving. Trauma doctors, nurses, and first responders, like the ones here today, work tirelessly to save the lives of those involved in alcohol-related crashes. But we in the medical profession can only do so much to repair the damages of impaired driving, the physical and psychological damage that we witness every day. The lives we're able to save give little comfort to the families and communities who have already lost loved ones to those crashes. The hardest thing to tell a mom or a dad that your daughter will never walk again, or your son will never come home or graduate because someone got behind the wheel drunk. In our trauma center at VCU, we admit more than 4,300 patients a year, mostly due to motor vehicle crashes, of which almost 1/3 have alcohol in their system. 1/3. That is 1/3 preventable injuries and mortalities. 1/3 preventable needless suffering. The most effective way to save lives on Virginia roads is to address the problem at the very source. We in the hospitals and throughout all the emergency rooms, we just cannot do it alone. All Virginians must do their part by planning a safe ride home if they're drinking. It's simple. Don't get behind the wheel after drinking. And don't let anyone else, your friends, families, and loved ones, get behind the wheel after drinking. Last year, 293 persons were killed on Virginia's roadways in alcohol-related crashes, which accounted to nearly 1/3 of Virginia's total traffic fatality. Again, that's nearly 300 families whose loved ones didn't make it home because someone made the mistake of drinking and driving, and someone did not stop them from doing so. Impaired driving is 100% preventable, 100% preventable. And we all must do our part to stop it. It is our responsibility to be engaged in these efforts that affect us all. Again, thank you for this. Thank you for coming today, and thank you for this very important opportunity to be part of this important campaign and this necessary message. Thank you.
I'm just looking at one stat that I want to make sure I share with you all. It's been mentioned, but I want to make sure that it's heard as we wrap up today. One is that the period between August 14th and September 2nd is the first mobilization of this campaign, and specifically in Virginia alone, 130 law enforcement agencies are going to be engaged in the Drive Sober, Get Pulled Over campaign, and they're going to be conducting 95 sobriety checkpoints and 610 saturation patrols. This is through Labor Day weekend. That said, this concludes today's news conference. I believe that the majority of today's speakers will be available for individual questions. You can find out today's materials, this year's fact sheet, and teasers for the launch of the What's the Damage creative campaign at whatsthedamage.org. And please keep an eye out for additional creative assets that are unveiled this fall. In the meantime, thank you all for attending.